And what I'm hearing too, and what you're saying, Dr. Pike, is this theme or this tension between individual employees and the organization. And maybe also the systems and structures that you spoke a little bit about earlier. So this tension brings up this question of responsibility.
Mm-hmm.
Who's responsible, or who has a duty to ensure mental wellness or mental health of our employees and our colleagues?
Mm-hmm.
I mean, I don't know that there's really a specific, like, one answer to that, but I would love for you to share your thoughts.
So there is what we call a duty to care, or duty of care.
Mhm.
And that is actually much further articulated in fair part of Europe compared to the United States, in terms of defining that role. But essentially it's there and it's growing, this sense of responsibility and obligation for organizational leaders to own that they are in the position of shaping the organizational culture, structures, and systems that will directly impact their workforce. The connection that is clearer for some organizational leaders than others is whether doing that has any impact on overall organizational productivity and returns. And those data also are very clear, that we know that if you don't attend to the mental health of your workforce, you have these big picture issues around reputation, recruitment, retention. The data are very clear about absenteeism. And absenteeism is a huge cost to an organization. Not addressing the mental health needs of your workforce increases absenteeism. It increases presenteeism. So people being at work, but not fully engaged in their work. So closing an office door and not being able to focus, not being able to concentrate, having to attend to some mental health crisis or need for themselves or a family member, and not working on whatever the work task is. So those data are really clear. What's more challenging is we know about mental health and mental illness. We know that not attending to them has a huge cost. A study a number of years ago that came out from the WHO was an estimate of about $1 trillion a year in terms of lost productivity due to not attending to people's mental health needs. And the challenge now is to say, okay, we know mental health matters. We know not paying attention is expensive to the individual and to the organization and to society. And now we need guidance on what can we do that where we can measure that by doing certain things, we can have a positive impact. And so that's where the Mental Health at Work Index sits. It's in that space of trying to bring science and bring best practices and rigorous measurement to organizations so that organizational leaders can actually see that by making certain decisions, by addressing certain issues, they are having a positive impact on their overall organizational culture, work design, other aspects that then have a positive impact on the workforce. And, one image that I don't know if this follows exactly, but there's one image that comes to mind for me in these conversations all the time, which is that within many workforce cultures, within many workplace settings, the assumption is that the employees, the workers, should be working at not only 100%, but 110 or 120% all the time. The language is always about increased productivity, increased productivity, increased productivity. And I, at those moments, have this vision of a thoroughbred racehorse. And the thoroughbred racehorse, the fastest horse that trains, the training associated with a thoroughbred racehorse doesn't have the thoroughbred racehorse running at 120% every moment of every day. And we have to really rethink what's the big picture game plan here? Because optimizing productivity means actually creating a lot of space for managing resources successfully so that when you really need to give 120%, you can, but you're not at 120% every moment of every day. And I think that's a real issue in terms of thinking about productivity in the workplace today.
Yeah, it relates back to the comment that you made around stress, and it's around, how much of it is there, what's the duration, and how much is it impairing you? And we think about sort of being in that survival mode and all the things that are possible in that acute survival mode. There's a reason for it. It's important. We don't want to completely shift from, no survival responses to all thrive, because then you're missing threats that are coming at you, and you're also missing these opportunities to really, really laser focus and push your own boundaries and limits. But it's not a sustainable state. It's not something that can persist over time because of all of the negative impacts of that sort of sustained mode. I'm curious, when you think about sort of all of the outputs that the Mental Health at Work Index shows, and all of the sort of focus or guidance that it might enlighten people to, in terms of what are some of the problems that we need to solve and where are some of the areas that we need to focus as an organization and as leaders. What do you see as some of the biggest challenges to leaders and organizations actually getting some of that work done and making some of those changes? Because there's the what we need to do, but then there's also the challenge of how do we do this? How do we make that progress?
Right. Real change takes commitment and time. And therefore, one of the challenges for organizations will be sustaining the conviction that making these changes will matter, and staying the course long enough to be able to reap the benefits. So we're talking about very real, very significant, profound opportunities. And some changes that organizations make, they'll get great feedback, and employees will actually report immediate benefit, right? So a change of workplace design where people have better light, like simple things like better lighting and a really nice space to sit during break time, can have a huge positive impact on people's mood and reducing stress. So there's some wins that will happen quickly, but longer term enduring benefit is going to take time to measure. And so I think one of the things is, one of the challenges, but certainly one that can be addressed for organizational leaders, is to stay connected to groups like Kotter, like the Mental Health at Work Index, to build communities of organizational leaders who can support each other in this work and where people can learn from each other, because that creates a sense of movement, actually, and a sense of support and learning. And we all need to be learning as we go in this work. So I think that's one of the challenges and opportunities. The other challenge is internal to an organization. There will always be naysayers. There'll be people who don't think it matters, people who think that the young professionals are excessively needy and demanding. And organizational leaders are going to have to think very strategically about how they address the naysayers, because this is a moment of culture shift. And so at a certain point, either people need to get on the train, or it's going to leave the station without them. So I think that's a challenge, and bringing people in who are the naysayers to the work, I think, is a really effective strategy, because there are legitimate concerns about organizations being asked to do a million different things, and organizations need to focus, right? So it's a legitimate concern about focus. It may be the lack of appreciation around mental health may be driven by being uninformed, or actually may be driven by fears around mental health issues that they or someone in their family has that they don't want discovered. It could be driven by a number of different things, but bringing those folks into a conversation about what would it take for this to make sense to you? Because if it requires that it has real return on investment, we can demonstrate that. If it requires that it will reduce various burdens at work, actually it will reduce various stresses at work if we address these issues, we can demonstrate that. So many of the concerns that people have could actually be taken head on if they're brought into the conversation. So I would encourage leaders who have naysayers to actually, put an arm around them and figure out what the resistance is and try to take it head on, address it head on, because I think we can actually, I think we have the data to counter the concerns that those naysayers might raise. And then I think the third challenge for organizational leaders is related to what I just said, that there are many, many demands on organizations today, and there is limited bandwidth. So it's really important that organizational leaders think very strategically about what's going to matter most in their organization, so that the efforts produce benefits that the community of employees experience and appreciate, and you start to build a virtuous cycle that then creates a momentum for real change.
Do you have an example of an organization or a group of people who did this really well? So this meaning recognizing the issues and then getting it right, and then seeing amazing outcomes after that.
So there are a number of exemplary organizations that are really working on these issues in a very serious way. The founding principal partner of our founding corporate council is AXA, led by AXA Asia and Africa. The CEO there is Gordon Watson. And I mention them because we're working closely with them. I can speak to some of the observations that I have of how a complex organization, multinational corporation, can really make a difference, keeping in mind that there are many other examples. In the case of AXA, they have made it part of their strategic plan to address mental health and have integrated it into their strategic plan and have thought about it in ways that have brought the workforce into the conversation, so that they've pursued not only leadership training, which is essential. You need leadership at the top to say that we respect that these issues matter and that we are learning about mental health and we are bringing mental health into our leadership and informing decisions that we make as leaders. So they've done successful leadership training, and then also bringing workforce into discussions around workforce design and generating new products to support their workforce, including some AI technologies, for example. When you start to put together that kind of program where you have committed leadership integrated into your strategic plan, supporting leaders, engaging workforce, you begin to see the dynamic impact and the ways in which then it grows and takes on a life of its own. And I think that's what AXA would describe today in terms of what's happening as they have accelerated their focus on mind health, mental health.
On the flip side, have you seen examples, or do you have an example that you could share of maybe an organization or a group who maybe with really good intentions has made some efforts that have been detrimental or unsuccessful, but they've gone at it with all of the best intentions and good ideas, but it's fallen off for some reason? And are there lessons that we might learn from that?
So I don't have personal experience with an organization where I would tell that story, except there are public examples of organizations like Amazon, right, that had certain workplace conditions that put undue burden and undue stress on employees in ways that had significant negative impact that then went public, right? It became a real reputational crisis for Amazon. And as an organization, again, I'm not working with Amazon. I don't know the inside story, but my observation is that Amazon actually now is in fact focused in a very real way on addressing those issues, understands that if we don't address these issues, we lose our workforce. And that's the reality today.